This is Dr. Anina Abraham from Advanced Retina Care. I'm going to talk about what you can expect after retina surgery. Now, retina surgery is so advanced these days. It's not like it was a decade ago. A decade ago, there was a lot of pain, inflammation, swelling in the eye for almost a month. But today, things are so advanced that without stitches, the finest instruments are introduced inside the eye. The surgery is done and these instruments are removed. It's called vitrectomy surgery, and you have 23 gauge, 25 gauge, 27 gauge available. The gauges are becoming smaller and smaller. It really doesn't matter. At the end of the day, the recovery is so quick. Now, the very next day, most of the time, you have absolutely no pain. In fact, the eye looks like an unoperated eye. Sometimes even after a cataract surgery, your eye can be inflamed and red, but after vitrectomy surgery, it's absolutely clean the very next day. We just wait for the anesthesia effect to wear out. After that effect wears out, there can be mild pain on the same day as the surgery, in which case you can take a paracetamol tablet or something, and with that it's done. So the second thing you can expect is vision. Now, vision does not recover immediately in some cases. Now, it depends upon your case. It depends upon what you were operated for. If you were operated for something as simple as floaters, your vision can recover 100% the next day. However, if you've been operated for a vitreous hemorrhage, which is a bleeding inside the eye, what happens is sometimes there can be some oozing of blood the next day. That may take a week, 2 weeks, sometimes a month to clear. And some patients even require a wash, a vitreous lavage, it's called, a washing of this blood for that to go. So we give it a month's time for vision recovery. Again, if you've been operated for a retinal detachment, it depends on whether oil has been injected or gas has been injected inside the eye. If oil is injected, vision slowly starts recovering from day one. But again, when oil is inside the eye, it's like a thick refractive glass is inside the eye. So you will need a +5, +4 glass to see better. Your vision will recover once this oil is removed, which is done 3 to 6 months later. If gas is injected inside the eye, your vision is a total blackout. But there's nothing to worry because vision comes back the moment the gas bubble gets absorbed. That takes about 6 weeks for complete absorption of gas. It depends again on which gas is used inside the eye. Then for cases of macular hole, it takes about 6 weeks for the hole to close. Again, it depends upon the tamponade. Cases of diabetic vitrectomy, diabetic eye disease, in which there's severe retinopathy and tractional retinal detachment. It depends upon the condition of your retina. If the retina is very weak, the optic nerve is not receiving enough blood flow, if the retina is full of membranes, or if there is bleeding under the retina, vision recovery may not be complete. The health of the macula, which is the center of the retina, is extremely important because this determines your final visual acuity. At the end of the day, vision is not just about seeing the fine print, it is about peripheral vision as well. So if your surgery can be done even to preserve peripheral vision, you must undergo the surgery. Retina surgery has become so advanced, the success rate is enormous, and all this is thanks to the latest technologies which are available, the latest equipment which is available. You must not hesitate undergoing a retina surgery.